when you add in all sorts of endocrine disruptors, testosterone, birth control, etc., because the body's smart. And then you end up with just kind of fubbernecking the whole thing. There's a lot of ways in which the body can get pretty much screwed up. Is it a production issue? Is it a conversion issue? Right? Where's the body struggling after it got that endocrine disruption, that damage? And remember, a lot of people don't feel normal after touching birth control. And no one told you there'd be work to do to get back to normal. But again, that's what we do here at the Wellness Way, right? We figure out what those normal functions have been damaged, what they're trying to do. We help provide the resources necessary to help the body deflame and begin that normal repair process. How many times have you heard your doctor say, your lab work is all fine, nothing abnormal here, it's probably just in your head? Are you depressed or anxious? Here's medication. We've all been to the doctor and heard that kind of thing. Doc, I don't feel normal. Well, your lab work says things are normal, so it's in your head. Excuse me, but I'm having this, I'm having that, I'm going through this, like very objective things in your life, and it's ignored because it doesn't show up in the lab work. All the time we run a lab and say, here's where your problem is. This is why that's happening, and connecting those dots for people, the why behind their health, right? I've seen a lot of women, young, old, all hurt by birth control and given no guidance on how to get their life back to normal. But again, that's what we do. You have to keep in mind how somebody's trained, right? Your medical doctor is trained to deal with medical emergencies. And so when they look at a lab, they're looking for things that are clearly out of range, either direction, high or low. And unless something is truly out of range, they might say, well, it's a little higher. They might say, well, it's a little low. Remember, they operate from a surgical and a medication standpoint. That is the answer to the whole issue. Why does my doctor not see a problem? Because to him, he cannot see a problem that he can help you with. But from my standpoint, remember, my mastery is in the normal function of the body. It's like looking for a counterfeit, right? You don't look for counterfeits by studying counterfeits. That's what your doctor does. He looks at disease. He looks at counterfeits. You really get good at finding counterfeits when you study what a normal dollar looks like, when you become intimately familiar with what does a normal dollar look like, be like, I think smell like, right? These guys do some like crazy stuff with dollars. You become intimately familiar with what normal should be. That's where I rest. I care about how you're doing, and I care about your disease in that it's a result of abnormal function over long term. If you are severely traumatized by something, please go to your medical doctor. That is exactly what they're there for. They're masters at dealing with that. If I have a heart attack, I love Dr. Flynn, but I'm not going to him if I have a heart attack. And he's not going to help me either. He's going to put me in the hospital because that's what I need at that time. I need something to save my life. But with that being in mind, the doctor's going to say your labs are normal because he can't give you drug or surgery for something that's slightly off. They can try, but that's where we end up with a lot of our over-medication issues nowadays. And especially with trying to return to normal, medication doesn't restore normal function. Remember, it's a non-lethal dose of a toxic substance. It's not going to restore normal. It's going to force a function to stop happening, or in some small instances, increase a function. Okay? It doesn't help the body return to normal. That's what we do. We help that body with restoring that normal function. It's why I can look at a medical lab and say, this is what they missed for your concern. This is how this relates to your concern. I can show people that. I had a lovely conversation with a lady. She was overseas. She's like, Doc, I can't sleep. Like, I can't even get 2 hours a night. I don't feel like myself. What's going on? Well, can you show me your labs? But they're all normal. Normal to who? Normal to your medical doctor? Well, yeah. Am I your medical doctor? No. Okay, so why do you think I will look at them the same? Then I looked at her labs, like, okay, we're getting, like, there's some liver distress going on. I can see your enzymes are not in the ratios that they should be. I can see that they are providing evidence of distress. And you're starting to accumulate fat on the liver, right? All of which is going to affect a lot of things.